Good afternoon, everyone. It's great to have you here for our discussion with global health expert, Dr. Jacob Gayle. Someone else is going to introduce him, but I want you to know that Ohio is kind of a homecoming for Dr. Gayle. He earned his bachelor's degree at Oberlin College and his master's and PhD degrees at The Ohio State University. So you're going to learn more about him, but I just had to say, welcome home. First, I want to just tell you something about our Power of Diversity series. The university's Office of Inclusion, Diversity, and Equal Opportunity sponsors the Power of Diversity lecture series to inspire dialogue about diversity and inclusion on our campus and in our community. The annual series includes presentations from distinguished guests as well as faculty members of Case Western Reserve. Previous speakers have included Harvard law professor and author Charles Ogletree, Mae Jemison, the first African-American woman in space, and Dr. Julianne Malveaux, then president of Bennett College. Just last month, we discussed the diversity of social justice with Dr. Rhonda Williams, a professor at Case Western Reserve in the College of Arts and Sciences and director of our university's Social Justice Institute. And on November 6th, that's next Tuesday, for those of you who have your calendars out, the lecture series will present a discussion of health disparities and the e-health revolution with Dr. T.J. McCallum, a faculty member whose research focuses on older adults, caregivers, and the stress on both groups. At Case Western Reserve, we strive to not only discuss diversity and inclusion, but to exemplify it in the things that we do. This fall, Case Western Reserve was proud to welcome our largest, most academically accomplished, and most diverse class in our history. And it is a great milestone for us. Leading our charge on all things related to diversity is Dr. Marilyn Sanders Mobley, our Vice President for Inclusion, Diversity, and Equal Opportunity. Marilyn and her team met with literally hundreds of faculty, staff, and students across our campus, as well as community members, to develop the university's first ever Diversity Strategic Action Plan, which was ultimately adopted by our board in June. I often refer to it as our roadmap for inclusion and community building for years to come. I am truly proud of our plan and of the efforts of our campus community to create the kind of rich academic and social environment the university should always enjoy. We're not done yet, but we've made terrific progress. It is my privilege to welcome Dr. Mobley to the podium to introduce our speaker today, Dr. Gayle.
Good afternoon. Thank you, President Snyder, for that warm introduction. I have the honor of introducing our speaker today for our Power of Diversity series, Dr. Jacob Gayle, who joined the Medtronic family in August of 2011. So he is new in the position and has recently moved to begin this work in earnest, but he is the Vice President of Community Affairs and Executive Director of the Medtronic Foundation at Medtronic Incorporated. In these capacities, he leads the strategic development and implementation of global corporate citizenship programs, including philanthropy and employee engagement. And we've learned quite a bit about how he's doing that today with his own strategic planning process. Dr. Gayle served as Deputy Vice President of the Ford Foundation, leading its 5-year special global initiative on HIV/AIDS from September 2005 until October 2010. This senior leadership role in global philanthropy built upon an illustrious global career in public health that spans across nearly 30 years in several of the leading worldwide institutions responsible for global health and development, including the U.S. Center for Disease Control and Prevention, the CDC, U.S. Agency for International Development, USAID, the United Nations, World Bank, and the Carter Center. Dr. Gayle has served through postings across the U.S., South Africa, Barbados, and Switzerland, and now he's been traveling even more, we've learned. Immediately preceding the arrival at the Medtronic World Headquarters in Minneapolis, Gayle spent a year at U.S.-based Social and Scientific Systems Incorporated as Director of Caribbean Programs, supporting the efforts of the United States National Institutes of Health Office of AIDS Research by serving as its ambassadorial emissary and strengthening its Caribbean programs and partnerships. With an earned doctorate in international community health master's in community health education, and a master's in preventive health, all from, as you heard President Snyder say, The Ohio State University, and a BA in psychobiology from Oberlin. Dr. Gayle was a tenured professor of community health at Kent State University before joining the CDC in 1989. The CDC is kind of how we know each other, I think. His sister went to undergraduate school with me at Barnard College of Columbia University, and at one point also worked at the CDC. So we are pleased to have him on our campus. He's been learning about us all day. We'll be learning more tomorrow, we understand, and it's an honor for us to have you here. We have so many students who are interested in your work, as many members of our leadership team are with us today. So please help me welcome Dr. Jacob Gayle.
Thank you very much. First of all, I want to say to all that are here, good afternoon. I want to thank President Snyder, first of all, for having me here on the campus of Case Western Reserve University, and for all who have been responsible and involved with planning for my participation. If I were in the Caribbean today, I would, in fact, go through the list of all of the dignitaries and all of those who have led the way in terms of both my day-to-day at Case Western, as well as the wonderful day that I see I'll have tomorrow. Yet, I have to admit that, unfortunately, we're not in Barbados today, and I recognize that therefore, in Cleveland, I think I'll just say, recognizing all protocols that should be followed, I, in fact, assume that they have been followed indeed. I want to forewarn you about a couple things. One is that, as was said earlier, I am a former professor. In fact, I received my tenure as associate professor just down the road at Kent State University, not too far from here. I also was a regular for a time on morning television here in Cleveland. I think it was AM Cleveland. I used to be their health consultant, and I'd come on maybe once a month or so, and I am somebody who used to watch. And so I'm saying all that to say is that I have this propensity to be able to tell stories, to pontificate on almost anything, and ultimately, at the end of the day, long day's lecture, give you an exam. I'm going to pass on that opportunity today, and to try to protect you from all of that, I think it's best that I first both share with you the limits of what I expect to cover today and also give you a summary up front. So now, if I do that, that does not give you license to duck out of here early, okay? In fact, I have somebody here who's going to be taking names, and we are going to check the security tapes afterwards. So stick around. All but one has permission to leave. I mean, none but one has permission to leave. The points I want to make are these. Number one, as I'll talk about in a moment, we are actually more same than we are different. Whether you check our genes, our traditions, or our aspirations. That should give most of us a sense of relief, because it appears that human nature continually drives us toward seeking uniformity and conformity. Number two, we are nonetheless diverse, and that's actually essential to our survival. And when we do gravitate toward the new normals, they're usually stronger because they've been derived from a recombination of heterogeneous contributions. Not only does that make us stronger, but quite honestly, it makes life more beautiful as well. Number three, speaking of life, life is constantly changing. Some things happen slowly through evolution. Some things happen almost overnight as through revolution. Sometimes we need both, but the timing between them can pose challenges to the effects and also to the outcomes. Fourth point, as we live closer and closer to each other in urbanized settings, we become more interdependent. And so what that does is it exposes us to common health challenges and necessitates healthcare delivery that is able to provide common services and yet do so in diverse ways. The only way the U.S. will succeed in protecting health and promoting well-being is to do what, quite honestly, every other industrialized country on this planet and many of the non-industrialized countries have already realized and have already done, and that is to come to realize that public health is only protected when health for all is made possible as part of our inalienable rights, as already is described within the International Declaration for Human Rights. So anyway, now that I've given you the Cliff Notes version of what I'm going to talk about, I feel like we can sit back, relax a little bit, and hear the fun parts. So I am going to start just a little bit and telling you a little bit about myself. As you can probably tell, I'm a child of the 60s and the 70s, and being born in the late 1950s, right at the U.S.-Canada border, and having family on both sides of the border, being born to a global-minded social worker and a social entrepreneur has literally given me genetic license to pursue my own commitments to health and human rights through global engagement and diplomacy. My siblings and I grew up being exposed to a multiplicity of cultures to be found between the US and Canada. And we were told that we should not only feel comfortable within each and really feel comfortable in all, but to really embrace them all as our own. After all, there's only but one family of man, or one family of man and woman, and we were a part of it all. We hosted international students studying in our communities. We learned Swahili. We even studied Yiddish from a book called Yiddish for Yankees. And that was all over and above the fact that we spoke English and French and Spanish and German. We were exposed to the faiths of the world, and we entertained diplomats, refugees, academics, and orphans. In our home, we oftentimes dined with men of faith and also women of the night. Like most of us who hailed from an African slavery heritage within the New World, we were the offspring of East meets West, North meets South. So we were taught to embrace it all because, quite honestly, we were composed of it all. As a result, my perspective of our role as global citizens was born from early exposure and early experience. Global citizenship is literally and figuratively in my genetic makeup. And without a doubt, as was mentioned, I'm an Oberlin College graduate, and I went to Oberlin in the 1970s. I think Oberlin may have had a little bit of impact in refining my identities and my perspectives as well. Through early childhood experiences and family connections, the Caribbean became the home of my affection and my affiliation. And even now, I know that I am at home when I land, whether it's in body or in spirit, amongst any of the many cultures of the West Indies or the entire Caribbean. And with predominantly African visible ancestry on my part, with identity strengthened by my godmother, who spent most of her diplomatic career across the African continent, we were reminded from early life of the contributions made by African peoples over many civilizations and all across the globe. So all that to say is that my concept of home is a global one. I don't believe that one must only have one family or one community. However, if I were forced to do so, my one community and my one family would be the family of humankind. We're taught that to whom much was given, much was required. If we weren't part of the solution for making a planet a better place, then clearly we were part of its corruption. We learned to live life with vision and mission, remembering those who came before us and made our successes possible, and those who come behind us and need our help in order to fulfill their destinies. It's probably for those reasons that I've always appreciated hearing the vision, missions, and goals of individuals and institutions, hear them articulate what their vision and their missions were. And having come from the organizations that were mentioned earlier, Centers for Disease Control, the U.S. Agency for International Development, the World Bank, having worked closely with people like Jimmy and Rosalynn Carter, Reverend Leon Sullivan, Sir George Alline, and others, I highly value the fact that, contrary to actual public thought and popular thought, one person, one organization, one vision can indeed change the world. Don't forget that. And so for me, 14 months ago, it was the Medtronic mission and the commitment to it and the reputation for living it that actually sold me on the Medtronic family and its philanthropy. From where I came, my move was seen to some as crossing over to the dark side. Ironically, having done so, I found more light and passion and not darkness over there. Here's a Fortune 100 company, the largest medical technology company in the world, that was founded in a small Minnesotan garage, car garage, co-founded on the principles of service and community engagement by a guy I understand some of them may know, named Earl Bakken, who as a kid was fascinated by Frankenstein and the power of electricity. That's what drove him. That led him to eventually create the first heart pacemaker. And then the story continues from there. To alleviate pain, restore health, and extend life is the Medtronic mission. And together with being a good citizen wherever we live and work, each of us, 46,000 employees across the globe, has opportunity to commit ourselves and our passions to collectively strive for this as we work and volunteer our time, our talent, and our treasures. But another organization I also wanted to congratulate just for a moment is the Bill and Melinda Gates Foundation. Within the first few minutes of every presentation I have ever heard, be it by Melinda, be it by Bill, be it by anyone else, they state their belief statement that all lives are of equal value. And I love that. And because those actions, the actions that come along with those words are even greater than the words themselves, I just especially commend them on globally practicing what they preach. So anyway, let me begin the main course of the conversation by focusing on a few key points. The first is the fact, as I mentioned before, that we as people have far more in common than we do in difference. While I was in college, I can remember nights where many of us from different communities, different countries across the world would come together and we'd share stories with each other about key rituals in our cultures, how we treat marriages, births, moving into adulthood, aging, death. Two things that came to my mind during it. One was, it's funny how sometimes the most solemn of occasions can actually elicit the greatest humor. I mean, if you've ever been to a family funeral, come on, you're supposed to be sad, but by the end of the day, some of the funniest things you learn about your family through it. But the other thing that I thought was really impressive is to note that no matter how nuanced each story might be, there were always more common threads amongst our practices than there actually were differences. When I was a child, I used to love to spend time, sometimes hours, staring at maps or staring at globes. And I sort of figured out that if you could cut out all of the continents and reassemble them together, they basically would start looking like it was one piece, like putting together a puzzle. And so I thought I had discovered something. Later, when I realized that there were theories and religious stories and cultural practices that all evolved around that same notion, I sort of realized I was perhaps arriving at the conclusion a little bit late. Have you ever heard of the story of Pangaea? How many people know what Pangaea is? Okay, so most people know Pangaea. The word is derived from the two Greek words that collectively mean entire earth. The story goes that indeed, until sometime between the late Paleozoic and Mesozoic eras, there was probably but one supercontinental landmass on Earth, and that eventually it was split into several separate landmasses. Over time, the people on each of these separate landmasses began to adapt to the unique conditions of each earthly placement. So though we may have originated from one source, let's call it Eden, the global disbursement drove the evolution of distinction in an effort to adapt for survival under new conditions. Hair color and texture, skin pigmentation, fast twitch versus slow twitch muscles, and so forth, had special survival benefits in given climes and given circumstances. The greater the diversity, the greater the adaptability, and the more stable the environment became, the better certain characteristics might be advantageous over others. Some have further stated that over time, these land bodies may have actually re-merged and re-separated. So multiple variations have occurred as a result of separation, a reunification, followed again by separation. Preferred characteristics would change and be strengthened through constant genetic redistribution and combinations. This, some sociobiologists might explain, gives reasons for why there seems to be an innate desire to quote-unquote return to Eden and to gravitate back to a genetic norm, a so-called melting pot. Another key concept to note is in the understanding and celebrating of diversities is evolution versus revolution. Now, when I start talking about those two, I always feel like I have to explain that I'm not talking about what I call sort of the soundbite definitions of the two. What I'm talking about is, in some instances, change occurs over a prolonged time frame and enables gradual adaptations to occur with less immediate trauma or challenge. In other cases, change occurs rapidly, and so rapidly that it overrides the normal stages or progressions that we would see between one state and another. So when humankind walked across continents or sailed across the ocean's blue, their bodies were afforded time to slowly adapt to changes in climate and in time. So it was the jet age that really contributed the experience of jet lag as we started revolutionarily speeding across distances faster than our bodies could naturally adapt. Social development can also be evolutionary or revolutionary. Over time, cultures change. After all, culture is but a set of norms or standards or repetitive actions that deliver expected results. Insanity, on the other hand, according to Ben Franklin, is just the opposite. Doing the same thing over and over again and expecting a different result. Culture should, therefore, help us to minimize insanity by enabling people to know just what to expect. And so I'm new to some of the science of private sector work like medical technology, but I find that it's sort of like the precursor to Motorola's concept of Six Sigma. People know what Six Sigma is? I sure didn't know until recently. I thought Six Sigma was like a martial arts kind of thing, you know. They've got a green belt, they got a black belt, you know, I don't know. I even thought about it in the context of family. You know, I started thinking maybe this had to do with the fact, like in my family, we've got Six Sigmas. 4 of us are in Phi Beta Sigma fraternity. 2 of us are Sigma Pi Phi Boule. I mean, there's 6 right there, right? You know, so I said, you'd have to understand Greek organizations to get that joke, I guess. But anyway, so now my understanding of Six Sigma is very basic and derived from a great learning opportunity I had at the Galway Education Centre in Ireland, where Medtronic Foundation supports science, technology, engineering, and math programs with young people who are catapulting these ping pong balls, you know, following very precise, very consistent details to ensure that they get the same results every time. They, and actually now I, learned from that repetition can be derived consistently if there are clear steps and clear expectations. That is, in essence, what culture affords us. In fact, if we maximize consistency and can predict expected results with greater and greater accuracy, if we can all look and act and think the same, it poses fewer challenges or threats. We can predict and we can prejudge. In fact, some might say that prejudice is a natural survival instinct. We predict outcome by relying upon lessons learned in the past based upon similar conditions. We prejudge in almost every step we take. So prejudgment or prejudice is based upon stereotypes, assumptions that basically certain actions or certain outcomes can be expected because evidence has proven them over and over and over again. In fact, isn't Six Sigma based upon stereotype or prejudice to some extent? Survival depends upon a certain amount of both, quite honestly. And because of this, we generally discriminate between actions, events, or individuals as a result. So to be a discriminating shopper or to discriminate between music styles or skills is seen to be desirable. To discriminate against people is a different matter. I remember early in the HIV pandemic when we, at Centers for Disease Control, advertised to the world the 4-H Club: hemophiliacs, heroin users, homosexuals, and Haitians. And by doing so, they were made pariah and suffered ostracism and violence as a result. And it became clear that that kind of discriminatory stereotyping and prejudice made innocent people vulnerable. And in two ways. Number one, not all gay people or Haitians or hemophiliacs or drug users were at heightened risk for HIV. And then the other is that while we were targeting those four populations, the virus was continually spreading in other groups of individuals that weren't part of the 4-H Club. Prejudice, stereotype can hurt. And yet every country and every culture must transform in order to be relevant over time. Nelson Mandela used to say to community leaders in South Africa that when culture itself conveys risks to survival, culture then must give way to new customs. It's for that reason that he called upon, very early in the early 1990s, he called upon tribal leaders in South Africa to adopt adult male circumcision and condom use, even though it may have been not part of the ambient culture, so to speak, but to do so to prevent the spread of HIV. So anyway, while we await another reformation of Pangaea to occur through evolution, a revolutionary Pangaea movement has people moving and resettling around the globe in revolutionary, almost frenetic paces. According to the International Organization of Migration's World Migration Report in 2010, the number of international migrants was estimated at 214 million in 2010. If this number continues to grow at the same pace as it has during the past 20 years, we could reach about 405 million migrants by 2050. The U.S. Census Bureau estimates that the entire world population exceeded 7 billion this year on March 12th. So even with a denominator of 7 billion, migrants represent a revolutionarily large proportion of our human community. New Pangaea does not wait for geological reunification. It's finding its own reunion in key spots across the globe. One is right here in the United States and across North America. I think we're always trying to return to Eden, and to get there, we're trying to recreate Pangaea. Folklore, stories of major faith, even science all seem to corroborate one consistent view. We probably all came from one single or common source and location. Who knows that better than Case Western Reserve University for where the scientists come from who discovered Lucy in supposedly the Garden of Eden. And despite all that this happened since we were together in Eden last, it seems like an internal compass urges us to return there someday as one. In fact, as John Lennon penned in a song, Imagine, if stripped of all the conditions that superimpose barriers and boundaries upon us, it seems that our basic human urge is to reunite. There seems to be a comfort in sameness with conformity. And yet at the same time we ostracize for differences. We seem to desire the very differences they possess, that others possess. Think about it. We seem to want that which is found outside of ourselves, our missing counterpart, so to speak. That's why curly-haired people desire straight hair. Those with straight will make it curly. Darker skin is bleached, pale skin tanned, thick lips eschewed for thin, and thin lips plump for full. Even within human populations, we think of as being fairly phenotypically homogeneous. Even in homogeneous populations, within them lie great genetic variability. So as a Caribbean person, I can usually easily look in a crowd like this and pick out a Trini, somebody from Trinidad, okay? The ubiquitous physical characteristics of African, Asian, European, Amerindian admixtures in the Republic of Trinidad and Tobago has, over centuries and several generations, created a new uniformity. The same is true with Ethiopians and other countries and cultures. In fact, we as humans are internal Pangaeas in our own rights, generational separations and mergings of genetics and cultures. Today's homogeneity is created from mergers from yesterday's diversities, over and over and over again. A group that greatly inspired, for me, my multicultural and global perspectives as a child was a singing group, a global singing group called Up With People. I don't know if anybody's ever heard of Up With People, but as a group, Up With People used to sing a song with the words that said, "What we need is a great big melting pot, big enough, big enough, big enough for the world and all it's got. It will churn for 100 years or more to turn out coffee-colored people by the score." Now, I know since the time Up With People sang it, I think Boy George and a few others sang it as well, but so whatever version you might know, it's the same words. And as you begin to look across even this racially charged and challenged United States of America, there is a quiet revolution of coffee-colored people emerging as the face of the new USA. Let me tell you a story. Diversity is essential for survival. Consider the lemming. Across the breadth of living creatures, there may be no finer example of homogeneity than that of the lemming. For it seems that, innate to their individual compositions, there is a preset proclivity to conform, follow the pack, and succumb to sameness, even to individual and collective perils. So each year, as they scramble en masse to their cliffside perils, lemmings are vivid reminders of the value of diversity. For unbeknownst to their neighbors, there are always at least two non-conforming, probably amorous lemmings who watch the course of events and say, "Bunk this. Let's go back home, turn on some good mood music, and see what happens. After all, if it's so good down there below, why doesn't anyone else ever come back and tell us about it?" It's those two lemmings who then survive, at least for long enough to produce the next season of lemmings for the future. Which also teaches us that even as apparently as identical as we may seem, there are differences, sometimes almost undetectable, that provide us just enough diversity to ensure variations that are essential for survival. Celebrate diversity. Because of it, we exist and we survive. It's this essential need for genetic diversity that is the cornerstone of reproduction. A study of genetics, whether of flora or fauna, shows that the greater the genetic variability, the hardier the offspring. The more inbreeding, the weaker the species. The field of sociobiology would even suggest that our human social and reproductive behaviors, and even gender-based differences, demonstrate the constant struggle between two innate forces for self-preservation: the maintenance of status quo and the creation of the master race. Another story. I am a storyteller. Is the glass half empty or is it half full? If you've ever ridden on a Washington, D.C. Metro bus, you know that that can be a half empty, half full experience of its own. However, one day when I was riding on the Metro bus in D.C., I read some poems that were displayed as part of a mobile literary exhibition and contest. One that caught my eye and my memory was entitled, "The Hydrologic Cycle Trades My Muddy Creek for Her Holy River." And it was written by Charles Edward Wright. And I told him I would make sure I mentioned his name. The poem goes like this. "It's fine to see the glass half full, I tell her. Just keep evaporation in mind. If the glass is half empty, she answers, you can always expect rain." Just a few years ago, the World Health Organization estimated that now more than 50% of the world's population lives in an urban area. On the day that this occurred, only one side of the half-empty, half-full debate was settled, and that is, we are indeed an urban planet now. By 2050, it's expected that 70% will be living in towns and cities. In developing countries between 1995 and 2005, urban populations grew by an average of 1.2 million people per week, or around 165,000 people per day. So in the evolution versus revolution debate, there's clearly revolutionary growth going on. It does not allow for normal, natural adaptation of urban communities to such changes of growth. So it's evident in the growth of slums and informal settlement communities. 1 in 3 urban dwellers worldwide, so that's about 1 billion people, live in slums and informal settlements. Until such time as the true Pangaea reconstitutes, humans have revolutionarily taken on to developing new Pangaeas through migration. This has obvious implications for urbanization and also for globalization. So globally, road traffic injuries are the 9th leading cause of death. Most road traffic deaths occur in low and middle income countries. Almost half of those who die on the road in crashes are pedestrians, cyclists, and users of motorized two-wheelers. Urban pollution kills about 1.2 million people each year around the world, mainly due to cardiovascular and respiratory diseases. A major proportion of urban air pollution is caused by motor vehicles, although industrial pollution, electricity generation, and in least developed countries, household fuel combustion are also major contributors. Tuberculosis incidence is higher, much higher in big cities. In New York City, TB incidence is 4 times the national average. And if you look at a place like the Democratic Republic of Congo, 80% of people who live with TB there live in cities. So urban environments tend to discourage physical activity and promote unhealthy food consumption. Participation in physical activity is made difficult by a variety of urban setting or factors such as overcrowding, high volume traffic, heavy use of motorized transportation, poor air quality, lack of safe public places, recreation, or sports facilities. Take the U.S. as an example. The U.S. is particularly challenged by both urbanization and globalization because as a nation comprised of one of the most global and diverse populations of any country on the world, in the planet, these global challenges play out every day in almost every metropolitan community on the soil. And as the only industrialized country on this planet that does not ensure universal access to basic primary health care to its citizens or residents, the challenges of health care are further compounded by disparities. The July 2011 population estimate reports that about 313,847,465 people lived here. The net migration was 3.62 migrants per 1,000 inhabitants. And when you add to that an 82% urbanization growth rate, the U.S. is clearly becoming rapidly, revolutionarily urban and global. Just sort of more on the cultural side, I'm told that there are 311 languages that are spoken here in the U.S. 162 of them are indigenous, 149 of them are immigrant. There are 14 million households here where English is not the primary language. Languages represent cultures, and cultures shape our knowledge and thoughts on key concepts like health, illness, and disease. Urbanization and globalization both pose some obvious challenges to health. I talked about some earlier, but let's think about infectious diseases. Any of us with the slightest understanding of germ theory will understand that proximity can fuel the spread of communicable diseases. And whether we're talking airborne, waterborne, foodborne, or bloodborne, being in close proximity to one another increases the efficiency of transmission. Urbanization also changes social and society identity patterns. Any sociologists here who know the concept of anomie? Anomie basically explains how individuals in high density, somewhat anonymous settings are more likely to sense a disconnectedness that allows them to act in a way that is less constrained by social responsibility and expectation. This can increase risk-taking behaviors, including greater intentional and non-intentional injuries, even violence-related behaviors. The increase in psychosocial and behavioral disorders can also be associated with this sense of social disconnectedness and alienation. I think that's especially the case when you're talking about individuals who are moving across cultures, across countries, across areas of familiarity to unfamiliarity. And just as a quick shout out, I'm glad to see Dr. Shabaya here, Dr. Judah Shabaya, who's with the Cleveland Afrocentric Learning Center, because that's what it's all about, is being able to provide the platform for people who are coming in from other countries, other cultures, other communities, to be able to have a way of being integrated into a system and into a community without having to go through some of these disruptions. But urban centers are highly diverse mega communities, so the need to approach health for all clearly will demand a recognition, a respect, and even a celebration of diversity, and a need for a people-centered approach that encourages individuals to take active direction in their health-seeking actions, and for caregivers to be culturally competent and conversant in helping to navigate the health-related system and the environment by eliciting the patient's cooperation and active participation. Health systems should not be what patients have to learn how to navigate and to serve. Health systems should serve and navigate for patients. But lest we believe that things remain static and less challenging back at the ranch in non-urban America, let me just tell you something really quickly about what's going on in non-urban areas. Kenneth Johnson of Loyola University reports that immigration and racial diversity have also increased greatly in rural USA and will likely continue to do so. In non-metropolitan areas, the Hispanic population has grown at a faster rate of any racial or ethnic group during the 1990s and the post-2000 period. African American rural population growth has also exceeded that of whites, though at a much less significant magnitude than Hispanics. So while on glance, if you just look at rural America, it still looks fairly devoid of diversity overall. But if you really look closely to the genetic change that's occurring, it's changing at a strident evolutionary pace. And even in terms of in-migration, in 297 rural communities across the U.S., it's the foreign-born population that actually exceeds 5% of the rural community for the first time in 2000. So why is that happening when, in fact, only 6.5% of the rural labor force is working in farming? The main growth in terms of population in rural communities is around manufacturing. And so while public resources are being challenged in developing and delivering health promotion and disease prevention and services with a very rapidly urbanized community, in the non-urban areas, health-related services are going to have to shift to more employer-based services, and oftentimes services that are provided from community settings like faith communities. So anyway, that's another whole story. And next time I'm here, if we have more time and all of that, I'll have to talk more about non-urban settings and the impact of diversity. So in 1978, the public health world recognized the global movement and the power of global health in identifying and declaring the goal of health for all by year 2000. Then the Director General of the World Health Organization, Halfdan Mahler, established the fact that in order for the world to be able to make an impact on the health of individuals, we have to look at the health of a collective. Many of my colleagues and my counterparts learned the definition of health from the World Health Organization definition, that health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. So what that definition tried to do is to take into account that health is not just about the body, but there are certain social and economic sectors and aspects within the scope of attaining health that, in fact, make health not only a physical aspect, but a holistic context and a part of health being reaffirmed as a human right. So, I would have a few arguments now if they were to redefine it and restructure it as to whether each of the words are correct. I don't think health is a state. I think health is a dynamic. But, for the most part, I think the point gets across. So when we speak of primary health care, whose definition of health do we use? The predominant healthcare system in the U.S. uses a definition of allopathic medicine as being the treatment of illness and the rendering of non-disease. And, allopathic medicine is based upon a germ theory that many of us in westernized contexts not only assume is the only way to understand health, but believe it to be the only real scientific evidence-based paradigm. And for those who've really studied it, you realize that that's not necessarily so. And yet, even if it were true, it's not the perception of many who live amongst us, hailing from cultures who have survived millennia longer than our own here. So in many instances, since perception is often reality, if it continues to work, then maybe if it ain't broke, you don't try to fix it. So how do you strengthen a healthcare system that can deliver health for all when all is as diverse in perception and perspective as the residents of the United States? Firstly, since there is only one, this is the only one, as I said, the only nation of its kind that has not taken on the Health for All commitment, it's clear that such a challenge can and must be taken on. When I was in South Africa, Nelson Mandela, just before he became president, made a comment that, in fact, the level of civilization that a society will be known for is identified by the manner in which it cares for its most vulnerable communities. I would even take it a step further and say that in order to be a truly sovereign state, a country must endeavor to ensure the inalienable rights of its citizens, of which, according to the International Declaration of Human Rights, access to basic primary health care is one. We'd need to talk at another time about what primary health care should entail and what would be the full package, but needless to say, there is a basic minimum that I believe any human being should have access to if, in fact, a member and a citizen of a country that states sovereignty. Dr. Michael Belzer, who is the chief medical officer at Hennepin County Medical Center in Minneapolis, was telling me just a couple days ago about the third largest cause of preventable death in the U.S. each year, killing 45,000 people unnecessarily. That would be like each year wiping out the entire worldwide employee population of Medtronic. That disease is called the disease of uninsurance. If these uninsured were protected, it would save not only public expenditure, but it would also save 45,000 lives. At the Medtronic Foundation, through the course of our strategic planning and our global consultations with key leaders, we have confirmed the validity of our course of action over and over again. In order to successfully strengthen the health system, we need to take a people-centered approach. By that I mean two things. People with health or disease-related needs, I'll call them at this point patients, need to be in the center. They need to be empowered, engaged, and supported to take action. Secondly, health workers, especially the first responders who are at the front lines of care, need to be equipped and activated to engage with patients inside their own communities and cultures, and when needed, be able to help them to navigate the healthcare system. That's why we've committed recently to, whether it's in India, South Africa, Brazil, or the US, ultimately to work within underserved communities worldwide. It is people who are in need and people who can help. And so we're hopefully willing and ready to support both, and I sure hope we have the support of Case Western Reserve University in doing so. But let me say that in conclusion, and one of my favorite actually quotes that I should have said in the beginning is one of the words that I understand Dame Elizabeth Taylor shared with each of her husbands, and that was, "Not to worry, I promise you I won't be before you long." But I know that I'm not here today as an expert on urbanization and healthcare. In fact, Case Western Reserve has a wonderful center on healthcare, urban healthcare, and I am really pleased that I had the chance to spend some time earlier today with Dr. Amy Schoen. Even experts in rural health can tell you more than I can tell you today. But my own messages today really are intended to be much simpler. They're things that I trust we already know, and even more hopefully that we already practice in our day-to-day lives. One, first and foremost, we must celebrate diversity. It's not only what changes our black and white world into splashing pictures of living color, but diversity, whether it's genetic or cultural, improves our chance for human survival. Secondly, even as global citizens, we need to know what we bring to the diversity table and be proud of it without feeling superior over the contributions of others. Third, the best way to protect our right to be is to defend the same for others. As Voltaire was quoted as saying, "I do not agree with what you have to say, but I will defend to the death your right to say it." As it relates to health, many roads and ideologies have led to the survival of human populations over millennia. If they were completely wrong, no one would yet survive to tell the tale. So keep an open mind. There may be yet more that we each and all could learn from the other's experiences. Fourthly, and as important as the other three, it is always yet people that make the world go round. Listen to and engage them as they seek your help as healthcare providers. How many of us are healthcare providers? How many of us are mothers or fathers? Big brothers, big sisters, neighbors. We're all healthcare providers. You want to do this because you want the same to be done for yourselves. Let them tell you what they know, how they feel, and what they think may be both cause and solution. It's what Berlin and Fox call the LEARN model. Listen, L, to the patient's perception of the problem. E, explain your perception of the problem. A, acknowledge and discuss differences and similarities. R, recommend treatment. Then N, negotiate treatment. In fact, what you learn when you follow LEARN is that our healthcare system is only as good as the people around whom it is centered, patients and caregivers. What you also learn is that even as we celebrate the beauties of our diversities, in fact, we truly do have more in common. Our dreams, our aspirations, our hopes, our experiences, our fears, our needs, than we ever have in terms of differences. So allow me, just a moment, to speak of a philosophy that I learned while I was living in Southern Africa, Ubuntu. To me, Ubuntu is a way of achieving these nearly unattainable imperatives. Just like the Golden Rule, there are different, sometimes competing definitions of what Ubuntu is. So Archbishop Desmond Tutu states it this way: Ubuntu speaks particularly about the fact that you cannot exist as a human being in isolation. It speaks about our interconnectedness. You can't be human all by yourself. And when you have this quality, Ubuntu, you are known for your generosity. We think of ourselves far too frequently as just individuals, separated from one another, whereas you are connected, and what you do affects the whole world. When you do well, it spreads out. It is for the whole of humanity. I like the way that Archbishop Tutus Daughter once told the story, and this was a story about her returning to South Africa shortly after independence. And even though independence occurred, there were still certain things that were being practiced from the old apartheid days. And she was driving with some friends from Mozambique back into South Africa and was stopped by the police, South African police, white South African police, and asked to show her identity card. Well, you have to understand that, this was the new South Africa. And it's important that even if you do comply, after all, she was in the middle of nowhere, if you've ever been to the border of Mozambique and South Africa. She knew she had to show some ID. but she could do it with flair. And so as she put her hand on her shoulder, on her side to show, I'm not happy with this, she pulls out her ID, she throws it over to him, he grabs it, and she heard her father's voice say, Ubuntu. And she looked at the policeman again with a whole new set of eyes and realized this kid can't be much more than 20 or 21 years old. And he looks scared. And it's nighttime. And there must be a reason why he stopped this car, because they must have expected that someone was entering the country who shouldn't, and he has a responsibility to protect our land. She took her hand from off of her hip, and she turned and she spoke to him, and she said, "This must have been a long day, huh?" And without looking up, he said, "Yeah." He said, "I bet you'd rather be home with your family right now than to have to stop some, person on the street." Yeah. I know how that is. In my job as well, sometimes I have to do things that I really, really don't want to do, but I've got to remember that we're all human beings trying to help each other. And he said, "Yeah." He looked up and he smiled, gave her back her pass, and she left. Now, she said, the next part of the story you're expecting to hear is that, every year they get together over holidays and they bring their families and all that. She says she never saw the guy again, doesn't know who he was, and, they probably would not recognize each other if they saw each other. She doesn't know whether that changed him at all, but it changed her. And she understood more and more what Ubuntu means. Whether through evolution or revolution, or a combination of two, our country and our community and our global world is transitioning to be an urbanized global society. So in fact, we may well be a half-full global community of varying, even conflicting cultures needing to find a symbiotic solution. Even so, we remain half-empty, so to speak, with still non-urban societies in great need. In either case, appreciation of diversities that both hold are key to our survivals. Finding solution that's relevant to the conditions of all requires the solutions to emanate from the very communities we wish to see served. Them must be us, and we must be them. We all already know how to do it. We learned it a long, long time ago as children. So truly, this is the end. Please indulge me as I share in closing what I believe is the answer to the complex challenges of globalization, urbanization, and diversity as it relates to health, healthcare, and, actually life in general. Robert Fulham's view of Ubuntu is stated as such: all I ever needed to know, I learned in kindergarten. All I ever needed to know about how to live and what to do and how to be, I learned in kindergarten. Wisdom was not at the top of the grad school mountain, sorry, President Snyder, but there in the sand pile at Sunday school. These are the things that I learned. Share everything. Play fair. Don't hit people. Put things back where you found them. Clean up your own mess. Don't take things that aren't yours. Say you're sorry when you hurt somebody. Wash your hands before you eat. Flush. Warm cookies and cold milk are good for you. Live a balanced life. Learn some and think some and draw and paint and sing and dance and play and work some every day. My favorite, take a nap every afternoon. When you go out into the world, watch out for traffic. Hold hands and stick together. Be aware of wonder. Remember the little seed in the styrofoam cup? The roots go down and the plant grows up, and nobody really knows why or how. But we're all like that. Goldfish and hamsters and white mice and even the little seed in the styrofoam cup, they all die. So do we. And then remember the Dick and Jane books which most of you don't even know what I'm talking about. And the first word you learned, the biggest word of all, look. Everything you need to know is in there somewhere. The golden rule and love and basic sanitation, ecology and politics and equality and sane living. Take any of those items and extrapolate it into sophisticated adult terms and apply it to your family life or your work life or your government or your world, and it holds true and clear and firm. Think what a better world it would be if all, the whole world, had cookies and milk about 3 o'clock every afternoon and then lay down with our blankies for a nap. Or if all governments had a basic policy to always put back things where they found them and to clean up their own mess. And it's still true. No matter how old you are, when you go out into the world, it is best to hold hands and stick together. Ubuntu, Amandla, Asante Sana. Thank you. Okay, yeah. Thank you.
Great presentation. You covered a lot of ground there.
Yeah. Well,
Sciences, the anthropology.
I warned you.
You're making me feel old about Dick and Jane and John Lennon. So, but great presentation, very consistent with what we try to accomplish here on the power of diversity lecture series. We've got time for a few questions. So, if you would have a question, please. Yes, please.
If we, and some of the statistics that you use, that there are 45,000 people killed because of a lack of insurance, why can't we as a society use Ubuntu?
Well, so in fact, I believe that in many ways, insurance is Ubuntu. You know, I think some of the, and mind you, I have to say that oftentimes when I speak of these concepts, I'm talking in a more global concept. I consider myself sort of a visitor in this country, and so I try not to talk about personal things that are going on here in the family here. So this is not supposed to speak to anything about current political or things that are going on, but we have to remember that health insurance is really oftentimes less about the individual and really about reducing the cost upon society. The fact that, for instance, let me use another example, the fact that you and I each has to use a seatbelt when we drive in a motor vehicle is actually not about my personal health or your personal health. It's about the costs that all of us have to share whenever somebody drives without a seatbelt, has a major accident, and we have to pay for their health care. And so I think the same thing in terms of really providing opportunities for coverage, and whether it's health insurance or whether it's just making primary health care available to anybody who walks into the door of the clinic. In many ways, I believe that is what Ubuntu is all about. And so I think what we have to really think about is, as a society, global society, is weighing the pros and cons, the costs and the benefits of providing the basic services. We would never imagine, I hope, allowing individuals to live a life without water or without food or without, a modicum of security and safety and housing. The same holds true with basic health care that as a human being we just have to survive. It's part of being alive, part of being a human being.
Thank you.
Other questions?
Please, sir. How does Medtronic define and how do you define global corporate citizenship, and how do you plan to increase that?
So I think Medtronic identifies global corporate citizenship many ways in its own Medtronic mission. And that is to alleviate pain, restore health, and extend life using all resources that we have, our people, our products, and our philanthropy. And so it's important, the Medtronic mission has 6 tenets, or 6 different aspects. The 6th tenet is that Medtronic will be a good citizen anywhere it operates in the world. Thankfully for the world, it operates in 155 countries. And so it really does aspire to try to make and leave its mark by providing service, whether it's related to, of course, improving health. We talk a lot about healthy Medtronic communities, but then also just in terms of volunteerism and engagement. 82% of Medtronic employees around the world volunteer their time in their community in some way or another. 75% of employees contribute their own money to support local efforts. And so I think that in many ways that is a large part corporate social responsibility and engagement. The way the company operates as well, trying to reduce pollution, trying to minimize unnecessary travel and hence carbon impact on footprint on the world, and all those kinds of things also play a role. Trying to find alternate means of being able to communicate, to convene. So from an environmental side, from a philanthropy side, from product side, and from human resource, I think we try to demonstrate our CSR.
Well, thank you again. We have a gift for you somewhere here. Thank you very much. We won't have to go over there.
Okay, well, thank you.
Thanks for your position.
Thanks.
Thanks again for being here.
Thanks for your hospitality. Thank you.